So now we're talking about the frontal bone, right here. The anterior part of the cranium articulates with the parietal bone via the chronosuture. And then the major markings are going to be the supraorbital ridge, or supraorbital margins, anterior cranial fossa, the frontal sinuses. So you have hollow sinuses in here, and we'll talk more about that in a little bit. And then ethmoid is going to be deep back in here, behind the nose, basically. And it forms the area between the nasal cavity and the eyes. And then the cribriform plate is going to be this part right in here, and that's where your nerve for smell has little parts that stick down into there that go into the roof of the nose. And then it has the ethmoid sinuses in them as well. And then there'll be little variations where you have wormian bones, which are bones that are in the suture of the skull. Okay, not everybody's going to have them. Some people will, some people won't. All right, now we're moving from the cranial bones to the facial bones. So there's 14 bones, of which there's only 2 that are not paired. You have the mandible and the vomer. So basically bones that are in the midline are not going to be paired. In the paired bones, you have the maxilla here, zygomatic. There's going to be some nasal bones in here, the lacrimal bone, the palatines, and the inferior concha. So mandible, there's a few things on here that you need to be able to know about palpation. All right, so you have this coronoid process right here. Okay, and we'll go into that a little more into palpation. But to feel that, basically, if you open your jaw, that's the part you'll feel coming forward. It's not back here where the actual condyle is. You feel that coming forward here. If you put your hand like underneath the cheekbone here and feel for the bone to come forward into your finger, that's going to be the coronoid process. That's for the temporalis muscle. And then you're going to have the angle of the mandible. And then, let's see. Alveolar margin is going to be here at the edge of the teeth. And then the mental frame is going to be here on the front. Okay? And that's almost like, you see that sculpture of the guy, like, doing this. It's like if you went like that to think. And you can, if you palpate real closely, carefully, you can almost feel there's a little opening right there. And the thing about palpation, and we'll talk more about that, is that people have a tendency to, okay, I'm going to find that thing, damn it. But it's more like the lighter the touch you have, the better you're going to be able to find things. Such like, because when you start palpating on each other and you're like, no, it doesn't work that way. So again, you have and then the mandibular condyles, that's going to be here. To feel that stick out, what you can do is move your jaw from one side to the other. If I move my jaw this way, you're going to feel it come out on that side. And then if you come forward, it's just basically in front of your ear. You can feel the mandibular condyles moving. And then you have the maxillary bone, which kind of is almost like below the end of the cheekbone here. This basically has the upper part of the teeth. So it'd be right in here. So they're fused to each other. They form the upper part of the jaw and the center of the facial skeleton. And then this one, the sphenoid is kind of like the keystone of all the cranial bones. All the other ones articulated. The maxillary bone is kind of the center of the facial bones. All the other facial bones primarily are going to articulate with it, except for the mandible. Okay, so then the zygomatic process is what's going to go out to meet the zygomatic bone here. And then you're going to have, again, alveolar margins, then we've got this other frame in here. I think it's an infraorbital frame, and we'll be showing that later. So then there's the zygomatic bone. Like I said, that's basically the bone of the cheek right here. And then it also forms part of the inferior orbit of the eye. So that's another one there that's on the list for palpation, is the zygomatic bone. As you go more towards this way, it's the maxillary, and then you come to zygomatic here. And then if you keep going back here, what's this? After the posterior to the zygomatic. Remember what was the bone here? Temporal bone, yeah. Then you have the other facial bones. You have the nasal bones here. Okay. Then the lacrimal bone. It's inside in here in the medial wall of the orbit. And then the palatine bones are back in the palate back here, behind the maxillary. No, they're sutures. These are considered, although the sutures are actually joints, they're more or less considered immovable joints. Although if you talk about a lot of like craniosacral therapy and things like that, there is movement in those joints. But the amount of movement is such that they don't really need any ligaments to stabilize, because the sutures are so interlocked. And then the vomer bone is going to be part of into the septum here. And then in the nose you have these concha or concha. There's three of them. The most inferior one is a separate bone. The other ones are part of other bones. And then you have the paranasal sinuses. And those are basically air-filled sacs. Most of them are going to have openings where they'll drain out into the nose and the throat. And what they do, they're air-filled sacs in 5 of the skull bones: the frontal bone, the sphenoid, ethmoid, and the maxillary bones. So then air enters into those sinuses and can flow in and out. And what they do is they make the skull lighter, and then they enhance the sound of the voice. And then, as anyone knows that's had sinus problems, those things can get blocked and congested and filled up with fluid and things like that, infected. So now, just to review on the anterior aspect of the skull, what's this bone here? Frontal. Then you can have the nasal bones here. What's this one here? Zygomatic, right? This one? Maxilla. And then, yeah, there you have the infraorbital foramen. Okay, this one? Mandible. How about this one? Sphenoid, right? And then on the side here, you start getting into the temporal. We'll have the side views of the skull here. Okay, so this one? Occiput. And then you have the superior and inferior nuchal lines. And then what's this bone here? Temporal. And then that's the maxillary process on the back there. Okay. And then this one? Parietal, right? And then that suture right there? Coronal. And then this one? Or that one? The sphenoid, right? And we covered the other ones there. So then here's, like I said, there's the sella turcica. This is part of the sphenoid bone here. There's parietal, frontal, temporal, the palatine. That's the back part of the palate. And then this here is going to be the maxillary. And then there's the vomer. It's one of the ones that's not a paired bone.